Phlebotomy Exam 50 Questions and Answers. Question 1. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 2. Which of the following is an example of an analytical component of quality assurance? Option A, double-checking patient identity wristbands. Option B, ensuring proper maintenance and calibration of automated laboratory equipment. Option C, delivering critical panic results to a physician on time. Option D, labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 3. Which of the following is an example of an implied consent scenario? Option A patient signs a formal document for an invasive procedure. Option B, an unconscious emergency room patient requiring urgent diagnostic lab work. Option C, a patient verbally states they agree to the blood test. Option D, a parent signs a waiver for their underage child. The correct answer is option B, an unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 4. Which of the following is a symptom of nerve injury during a venipuncture? Option A dull ache in the antecubital fossa. Option B, a sharp, radiating, electric-like pain down the arm. Option C, a sudden feeling of warmth at the puncture site. Option D, small red spots spreading around the arm. The correct answer is option B, a sharp, radiating, electric-like pain down the arm. Sharp, radiating, electric-like pain suggests contact with or irritation of a nerve. The venipuncture should be stopped immediately to prevent further injury. Dull discomfort, warmth, or petechiae do not signal nerve involvement in the same way. Question 5. Which additive is present in a light blue top tube used for coagulation testing? Option A, sodium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option C, sodium citrate. Sodium citrate prevents clotting by binding calcium while preserving coagulation factors for testing. The tube must be filled properly because the citrate-to-blood ratio directly affects clotting test accuracy. EDTA, heparin, and oxalate tubes use different anticoagulant mechanisms and are not substitutes for routine coagulation studies. Question 6. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A, lavender, green, red. Option B, red, green, lavender. Option C, green, lavender, red. Option D, light blue, lavender, green. The correct answer is option A, lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 7. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent. The correct answer is option A, informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 8. A phlebotomist must collect a cold agglutinin sample. How must this specimen be transported to the lab? Option A, chilled on a slurry of ice and water. Option B, maintained at body temperature, 37 degrees Celsius. Option C, protected entirely from light exposure. Option D, frozen immediately in dry ice. The correct answer is option B, maintained at body temperature, 37 degrees Celsius. Cold agglutinin specimens must be kept warm because the antibodies can react at lower temperatures and alter the sample. Maintaining body temperature helps preserve the specimen condition needed for accurate testing. Chilling or freezing would encourage the very reaction the test handling is designed to avoid. Question 9. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A, activated partial thromboplastin time, APTT. Option B, prothrombin time / international normalized ratio, patient / INR. Option C, bleeding time determination. Option D, complete blood count, CBC. The correct answer is option B, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 10. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 11. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A, 30 seconds. Option B, 1 minute. Option C, 2 minutes. Option D, 3 minutes. The correct answer is option B, 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 12. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option F, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 13. Which of the following additives is found in a grey top tube and works by precipitating calcium to prevent clotting? Option A, potassium oxalate. Option B, sodium citrate. Option C, lithium heparin. Option D, DDTA. The correct answer is option A, potassium oxalate. Potassium oxalate prevents clotting by precipitating calcium, making calcium unavailable for the coagulation cascade. It is commonly paired with sodium fluoride in grey tubes. Citrate and EDTA bind calcium differently, while heparin works through antithrombin. Question 14. Which gauge needle has the smallest lumen diameter? Option A, 18 gauge. Option B, 21 gauge. Option C, 23 gauge. Option D, 25 gauge. The correct answer is option D, 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 15. For which of the following tests must the specimen be protected from light immediately after collection? Option A, ammonia. Option B, bilirubin. Option C, lactic acid. Option D, prothrombin. The correct answer is option B, bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 16. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 17. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A, separating the serum from the red blood cells within 30 minutes of collection. Option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C, transporting the specimen to the laboratory on an ice slurry. Option D, utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 18. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A, to stop the arterial blood flow to the limb. Option B, to engorge the veins and make them more palpable. Option C, to anchor the vein and prevent it from rolling. Option D, to ensure the sterility of the puncture site. The correct answer is option B, to engorge the veins and make them more palpable. A tourniquet temporarily slows venous return so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 19. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, N95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 20. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 21. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option of light blue top. Option B, lavender top. Option C, gray top. Option D, green top. The correct answer is option C, gray top. Gray tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 22. Which of the following standard precautions applies to the disposal of used venipuncture needles? Option of recapping the needle before throwing it away. Option B, placing the needle in a biohazard bag. Option C, activating the safety device and placing it in a sharps container. Option D, dropping the needle into a regular waste bin if no blood is visible. The correct answer is option C, activating the safety device and placing it in a sharps container. Used needles must be made safe immediately and placed into an approved sharps container at the point of use. Recapping, carrying loose needles, or placing them in bags creates preventable needle stick risk. Visible blood is not required for an item to be treated as contaminated after use. Question 23. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A, human immunodeficiency virus, HIV. Option B, hepatitis B virus, HBV. Option C, tuberculosis, TB. Option D, malaria. The correct answer is option B, hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 24. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 25. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A, it causes severe tissue tearing upon skin entry. Option B, it carries an extremely high risk of causing hemolysis in the sample. Option C, it penetrates too deeply into the bacillic structures. Option D, vacuum tubes will lose their suction pressure entirely. The correct answer is option B, it carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 26. What clinical term describes a systemic infection caused by pathogenic microorganisms or their toxins circulating in the bloodstream? Option A, hematoma. Option B, sclerosis. Option C, septicemia. Option D, petechiae. The correct answer is option C, septicemia. Septicemia is a systemic bloodstream infection caused by pathogenic microorganisms or their toxins. It is clinically serious because organisms and inflammatory mediators circulate throughout the body. Hematoma, sclerosis, and petechiae describe local bleeding or vessel conditions rather than systemic infection. Question 27. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A. It breaks the vacuum seal of the multisample tube. Option B. It can cause permanent damage to underlying nerves and blood vessels. Option C. It dulls the needle tip and makes skin entry painful. Option D. It causes the patient's blood pressure to spike excessively. The correct answer is option B. It can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 28. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A. Health hazard. Option B. Flammability hazard. Option C. Instability or reactivity hazard. Option D. Specific or special hazard. The correct answer is option C. Instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 29. Which of the following tests is used to monitor a patient's heparin therapy? Option A. Prothrombin time, patient. Option B. Activated partial thromboplastin time, APTT. Option C. Hemoglobin A1c. Option D. Rheumatoid factor, RF. The correct answer is option B. Activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 30. What type of cleaning solution should be used to disinfect a phlebotomy tray on a daily basis? Option A. Concentrated isopropyl alcohol. Option B. A 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Option C. Warm water mixed with mineral oil. Option D. Liquid hand soap solution. The correct answer is option B. A 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Phlebotomy trays should be disinfected with a bleach dilution or EPA-approved hospital disinfectant. Daily and visible soil cleaning reduces transfer of bloodborne pathogens and environmental organisms. Water, mineral oil, or hand soap alone does not provide adequate surface disinfection. Question 31. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A. Proceed quickly with the puncture before they pass out completely. Option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C. Instruct the patient to take deep, rapid breaths to hyperventilate. Option D. Give the patient a glass of hot water to drink immediately. The correct answer is option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 32. What type of isolation precautions must be followed when entering a room to draw blood from a patient with an active vancomycin-resistant enterococcus, VRE, infection? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Contact precautions. Option D. Protective reverse isolation. The correct answer is option C. Contact precautions. VRE is commonly spread by direct contact with contaminated hands, surfaces, or equipment. Contact precautions use gown, gloves, and dedicated equipment to reduce transmission. Airborne and droplet precautions are reserved for respiratory spread. Question 33. What condition can occur if blood is drawn from an arm on the same side as a recent radical mastectomy? Option A. Syncope. Option B. Lymphedema and altered test results. Option C, petechiae. Option D, sclerosed veins. The correct answer is option B, lymphedema and altered test results. The arm on the side of a recent radical mastectomy may have impaired lymph drainage and increased risk for swelling. Blood collection there can worsen lymphedema and may also produce altered results from compromised circulation. The unaffected arm or an approved alternate site should be used whenever possible. Question 34. What type of vessel links the arterial system directly to the capillary network paths? Option A, arteriole. Option B, venule. Option C, vena cava. Option D, deep vein. The correct answer is option A, arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 35. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A, wearing a face shield when opening specimen tubes. Option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C, washing hands with antimicrobial soap for 20 seconds. Option D, following a strict order of draw sequence. The correct answer is option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 36. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A, interpreting abnormal lab results for patients. Option B, ensuring specimen tubes are collected, labeled, and transported correctly. Option C, changing medication doses based on therapeutic levels. Option D, performing complex tissue biopsies in the operating room. The correct answer is option B, ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 37. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 38. What is the primary purpose of the Joint Commission's National Patient Safety Goals, NPSG, in phlebotomy? Option A, to reduce the cost of laboratory testing instruments. Option B, to improve the accuracy of patient identification and eliminate diagnostic errors. Option C, to mandate the exact number of draws a phlebotomist must perform per hour. Option D, to regulate the salaries of medical laboratory technicians. The correct answer is option B, to improve the accuracy of patient identification and eliminate diagnostic errors. The National Patient Safety Goals emphasize accurate patient identification to reduce diagnostic and treatment errors. In phlebotomy, this directly affects bedside identification, specimen labeling, and matching the order to the patient. The goals are not designed to set draw quotas or regulate laboratory salaries. Question 39. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A, enlist colleagues to restrain the patient by force without nursing guidance. Option B, postpone the draw and consult with the nurse in charge of the patient's care. Option C, attempt to draw blood while the patient is asleep. Option D, cancel the test order permanently on your own authority. The correct answer is option B, Postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 40. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A. Full name and room number. Option B. Full name and date of birth. Option C. Attending physician and bed number. Option D. Date of birth and diagnosis. The correct answer is option B. Full name and date of birth. Two reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 41. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A. Wash the site with soap and water and immediately report the incident to a supervisor. Option B. Squeeze the wound to expel blood and apply a tight bandage. Option C. Wait until the end of the shift to fill out an incident report. Option D. Ask the patient if they have any blood-borne infectious diseases. The correct answer is option A. Wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 42. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids. The correct answer is option C. To cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 43. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A. Lithium heparin. Option B. Ethylenediamine tetracetic acid, EDTA. Option C. Sodium fluoride. Option D. Ammonium oxalate. The correct answer is option B. Ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 44. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 45. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A. Red. Option B. Green. Option C. Light blue. Option D. Lavender. The correct answer is option D. Lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 46. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A, pull, aim, squeeze, sweep. Option B, push, aim, slice, secure. Option C, pull, activate, squeeze, shake. Option D, press, aim, secure, sweep. The correct answer is option A, pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 47. What should a phlebotomist do if they accidentally puncture an artery during an attempted venipuncture? Option A, complete the draw quickly and label the tube as venous blood. Option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. Option C, leave the tourniquet tied tight to prevent a hematoma from forming. Option D, instruct the patient to bend their arm firmly over a gauze pad. The correct answer is option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. An arterial puncture during venipuncture requires immediate needle removal and firm direct pressure for an extended period. Nursing staff or the provider should be notified because arterial bleeding can form a significant hematoma. Continuing the draw or applying light pressure is unsafe. Question 48. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A, light green top, PSD. Option B, gold or red / black marbled top, SST. Option C, lavender top, EDTA. Option D, light blue top, sodium citrate. The correct answer is option B, gold or red / black marbled top, SST. Gold or red black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 49. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 50. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A, drawing blood from a patient who has explicitly refused the procedure. Option B, making a minor clerical error on a specimen tube label. Option C, forgetting to wash hands between routine patient encounters. Option D, accidentally causing a small hematoma during an authorized draw. The correct answer is option A, drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 51. What color top tube contains the additive EDTA and is the primary tube used for a complete blood count? CBC. Option A, lavender top. Option B, light blue top. Option C, green top. Option D, gray top. The correct answer is option A, lavender top. Lavender tubes contain EDTA and are the primary tubes for CBC testing. EDTA prevents clotting while preserving blood cells for accurate counts. Serum or heparin tubes do not provide the standard specimen required for routine CBC analysis. Question 52. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A, releasing the tourniquet within 1 minute of needle insertion. Option B, keeping the patient's arm down during the venipuncture procedure. Option C, allowing the patient to pump their fist repeatedly before and during the draw. Option D, transporting the specimen to the laboratory within 30 minutes. The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 53. Specimen tubes must be labeled at what point during the collection process? Option A, prior to entering the patient's room. Option B, immediately after drawing the blood, before leaving the patient's side. Option C, at the central processing lab desk. Option D, after the specimen has finished centrifuging. The correct answer is option B, immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 54. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 55. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 56. Chain of custody protocols are required for which type of laboratory specimens? Option A, routine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 57. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A, draw the blood anyway and ask the patient to state their name. Option B, look for the ID band on the nightstand or 4-pole and scan it. Option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D, verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 58. Which of the following tests measures the average blood glucose concentration over the past 2 to 3 months? Option A, fasting blood sugar, FBS. Option B, for all glucose tolerance test, OGTT. Option C, hemoglobin A1C, HbA1c. Option D, postprandial glucose test. The correct answer is option C, hemoglobin A1C, HbA1c. Hemoglobin A1c reflects the percentage of hemoglobin that has glucose attached over the lifespan of red blood cells. It estimates average blood glucose over roughly 2 to 3 months. Fasting and postprandial glucose tests measure glucose at a specific point in time. Question 59. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A. The vein is too small to yield an adequate sample volume. Option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C. The vein has a high tendency to collapse under normal vacuum tube pressure. Option D. The vein lacks a sufficient path to the superior vena cava system. The correct answer is option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 60. Which of the following options describes the best method to prevent a vein from rolling during needle insertion? Option A. Tying the tourniquet directly over the intended puncture site. Option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Option C. Having the patient pump their fist continuously during needle insertion. Option D. Inserting the needle quickly at a sharp 90-degree angle. The correct answer is option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Anchoring pulls the skin taut below the puncture site to stabilize the vein. This prevents rolling and allows a controlled needle entry. Tying the tourniquet over the site, fist pumping, or using a steep angle can increase injury or specimen problems. Question 61. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A. Sodium polyant whole sulfonate, SPS. Option B. Acid citrate dextrose, ACD. Option C. Sodium citrate. Option D. Potassium oxalate. The correct answer is option B. Acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 62. Why is the first drop of blood wiped away during a capillary puncture? Option A. It contains skin surface bacteria. Option B. It contains tissue fluid contamination. Option C. It hemolyzes too rapidly to be accurate. Option D. It clots too quickly to be collected. The correct answer is option B. It contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 63. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A. Informed consent. Option B. Expressed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 64. Which of the following tests requires a plain red top tube with no gel or additives? Option A. Complete blood count, CBC. Option B. Type and screen. Option C. Certain therapeutic drug levels that bind to gel barriers. Option D. Plasma glucose tracking. The correct answer is option C. Certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 65. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A, collecting a lavender top tube for a CBC test. Option B, submitting an underfilled light blue coagulation tube. Option C, delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D, affixing a handwritten label over a pre-printed barcode label. The correct answer is option B, submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 66. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A, adjust the depth of the needle to stop the swelling. Option B, remove the tourniquet, withdraw the needle, and apply firm pressure. Option C, advance the needle further to bypass the hematoma. Option D, request the patient to pump their fist to redistribute the blood. The correct answer is option B, remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 67. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C, a dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D, a clear, watery fluid component lacking any cellular proteins. The correct answer is option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 68. What clinical term describes a hard, cord-like vein that has become occluded or blocked due to repeated inflammation or chemical irritation? Option A, sclerosed or thrombosed vein. Option B, patent vein. Option C, tortuous vein. Option D, superficial vein. The correct answer is option A, sclerosed or thrombosed vein. A sclerosed or thrombosed vein feels hard, cord-like, and may be partially or fully blocked. Repeated puncture, inflammation, or irritating infusions can produce this condition. Such veins should generally be avoided because flow is poor and injury risk is higher. Question 69. What is the function of the thixotropic gel inside a plasma separator tube, PSD? Option A, to accelerate the activation of the coagulation cascade. Option B, to form a physical separation barrier between the cells and the plasma layer during centrifugation. Option C, to preserve the concentration of glucose molecules for 24 hours. Option D, to bind heavy metals and trace elements within the sample. The correct answer is option B, to form a physical separation barrier between the cells and the plasma layer during centrifugation. The gel in a plasma separator tube forms a physical barrier between plasma and cells during centrifugation. This reduces ongoing cellular metabolism and analyte exchange after separation. The anticoagulant in the tube is lithium heparin, not the gel itself. Question 70. If a phlebotomist must use a syringe to collect blood, what device should be used to transfer the blood into vacuum tubes? Option A standard needle attached to the syringe puncturing the tube top directly. Option B, a syringe transfer device with a shrouded needle. Option C, pouring the blood from the syringe barrel after removing the stopper. Option D, injecting it through a butterfly needle set. The correct answer is option B, a syringe transfer device with a shrouded needle. A syringe transfer device allows blood to move safely from a syringe into vacuum tubes without exposing the needle. The device reduces needle stick risk and helps maintain tube vacuum and fill order. Removing stoppers, pouring blood, or puncturing stoppers with an exposed needle is unsafe. Question 71. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A. Use the partial sample anyway and send it to the lab. Option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C. Pour blood from a green top tube into the light blue tube to top it off. Option D. Shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 72. Which of the following actions represents the correct method for mixing an additive collection tube after drawing? Option A. Shaking the tube vigorously up and down 10 times. Option B. Inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Option C. Letting the tube sit completely undisturbed in a vertical rack to mix over time. Option D. Rolling the tube vigorously between your palms for 2 minutes. The correct answer is option B. Inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Additive tubes must be mixed by gentle inversion for the number of times recommended for that tube type. This distributes the additive evenly without causing hemolysis. Vigorous shaking or inadequate mixing can create clots, cell damage, or inaccurate results. Question 73. Hemoconcentration can be caused by which of the following actions? Option A. Leaving the tourniquet on for longer than 1 minute. Option B. Using a needle that is too small for the vein. Option C. Inverting the collection tubes too slowly. Option D. Puncturing the skin before the alcohol is dry. The correct answer is option A. Leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 74. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A. Wearing a laboratory coat. Option B. Utilizing self-sheathing safety needles. Option C. Hand washing after every procedure. Option D. Disposing of waste in a biohazard trash bag. The correct answer is option B. Utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls. Question 75. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A. Lightmia. Option B. Icterus. Option C. Hemolysis. Option D. Hemoconcentration. The correct answer is option C. Hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lightmia appears milky, and icterus appears yellow to amber. Question 76. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A. The posterior curvature of the heel directly over the calcaneus bone. Option B. The medial or lateral margins of the plantar surface of the heel. Option C. The central arch area of the foot pad. Option D. The tips of the smaller toes. The correct answer is option B, the medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 77. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A, hypovolemic shock. Option B, septic shock. Option C, anaphylactic shock. Option D, cardiogenic shock. The correct answer is option A, hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 78. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 79. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option A, light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 80. Which of the following tubes contains the anticoagulant lithium heparin? Option A, light green top, PSD. Option B, dark blue top. Option C, yellow top. Option D, grey top. The correct answer is option A, light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 81. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, DDTA. Option C, sodium polyant whole sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 82. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 83. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT. Instruments. Option A. Calibrating the machine once every year. Option B. Running control solutions at scheduled intervals according to facility protocol. Option C. Cleaning the display screen with water after every patient test. Option D. Trusting the automated self-check system without external verification. The correct answer is option B. Running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 84. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B. Drop the needle into a biohazard waste bag with blood-stained gauze. Option C. Set the needle down on the patient's bedside table until the tubes are fully labeled. Option D. Detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 85. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A. Layered drop upon drop until the circle is saturated. Option B. Applied to both sides of the paper simultaneously. Option C. Brought into direct contact with a single large drop to fill the circle completely. Option D. Smeared across the surface using a plastic capillary tube. The correct answer is option C. Brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 86. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic metabolic panel, BMP. Option B. Forensic drug analysis or paternity testing. Option C. Therapeutic drug monitoring for digoxin. Option D. Blood culture tracking for endocarditis. The correct answer is option B. Forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 87. What does a trough level measure in therapeutic drug monitoring, TDM? Option A. The highest concentration of the drug in the patient's system. Option B. The lowest concentration of the drug, measured right before the next dose. Option C. The average concentration of the drug over a 24-hour window. Option D. The amount of drug excreted through the kidneys. The correct answer is option B. The lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 88. What should a phlebotomist do if they observe a hematoma forming rapidly under the skin surface while performing a venipuncture? Option A. Adjust the needle angle to try to drain the hematoma into the collection tube. Option B. Terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. Option C, instruct the patient to pump their fist forcefully to redistribute the blood. Option D, advance the needle deeper to pass completely through the hematoma layers. The correct answer is option B. Terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. A rapidly forming hematoma means blood is escaping from the vessel into surrounding tissue. The draw should be stopped, the tourniquet released, the needle removed, and firm pressure applied. Continuing the attempt can enlarge the hematoma and increase pain or bruising. Question 89. Which additive acts as a glycolytic inhibitor in a gray top tube? Option A, sodium fluoride. Option B, lithium heparin. Option C, DDTA. Option D, thrombin. The correct answer is option A, sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in gray tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 90. Which of the following is the most critical step in performing any phlebotomy procedure? Option A, choosing the correct size needle. Option B, verifying patient identification. Option C, selecting the appropriate vein. Option D, applying the tourniquet tightly. The correct answer is option B, verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 91. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A, 70% isopropyl alcohol. Option B, tincture of iodine. Option C, chlorhexidine gluconate or soap and water. Option D, hydrogen peroxide. The correct answer is option C, chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 92. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 93. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A, draw the specimen and cross out the number on the tube label. Option B, proceed with the draw as long as the alphabetical spelling of the name is correct. Option C, do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D, ask the patient which number is the correct one to use. The correct answer is option C, do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 94. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A, vehicle-borne transmission. Option B, vector-borne transmission. Option C, airborne transmission. Option D, direct contact transmission. The correct answer is option A, vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 95. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A. Draw the blood quietly without waking them up to minimize pain. Option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C. Skip the patient and mark them as unavailable on the computer. Option D. Ask the patient's roommate to confirm their identity for you. The correct answer is option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 96. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A. Lactic acid and ammonia. Option B. Cold agglutinins and cryoglobulins. Option C. Bilirubin and vitamin B6. Option D. Prothrombin. Patient. The correct answer is option A. Lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 97. Which of the following structures is an example of an unoxygenated blood carrier? Option A. Pulmonary vein. Option B. aorta. Option C. Superior vena cava. Option D. Brachial artery. The correct answer is option C. Superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 98. What does the term basal state refer to in clinical laboratory testing? Option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B. The physical state of the body directly following a heavy workout session. Option C. The point of highest metabolic activity in the afternoon. Option D. The body state while under heavy psychological stress. The correct answer is option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 99. What type of patient environment requires protective, reverse, isolation protocols? Option A. A patient with an active, contagious respiratory flu virus. Option B. A patient with an open, draining MRSA wound infection. Option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D. A patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 100. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option A. Light blue top. Option B. Lavender top, EDTA. Option C. Gray top. Option D. Green top. The correct answer is option B. Lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology.